afternoon and thanks for joining us. I'm Judy Simpson. Today on the program we feature another segment of our ongoing series with the Vermont Cancer Center at the University of Vermont and Fletcher Allen Healthcare. Our focus this afternoon is on men's cancer. Overall, medical evidence indicates that men ought to pay more attention to their health. In fact, men are more likely than women to smoke and drink, and men are also more likely to put off regular checkups or seek medical care. The reality is that many of the major health and cancer risks that men face can be prevented. So this afternoon, I'm joined by two experts from the Vermont Cancer Center. They're here to raise awareness specifically about men's cancer and to discuss the prevention and screening that is available. I want to welcome Dr. Mark Plant and Dr. Bruce Levitt. Dr. Plant specializes in urology and Dr. Levitt specializes in cardiothoracic surgery. They are both members of the Cancer Center and professors in the UVM College of Medicine. Thanks so much for being with us. Mark, let's start out by talking a little bit about what are the leading cancer dangers among men.
So really the three that are the most common and remain the most common today are lung cancer, prostate cancer, as well as colon cancer.
And so what about mortality rates? Which cancers, Bruce, are more likely to be deadly among men?
Well, the incidence of prostate cancer is the highest in men, but clearly the leader of cancer deaths among men is lung cancer.
Is that a big change?
Well, I think that the lung cancer continues to be one of the leading causes of cancer death in men. In 1988, it surpassed the cancer deaths in women compared to breast and gynecologic cancers combined. But in men, it's still one of the leading causes of cancer death, and one that's preventable if we're able to detect the cancer early.
And is there any particular reason why men are more susceptible?
Well, I think that, in general, over the years, men have, smoked more than women, and smoking has clearly been linked. There was just the other day in the news, it was the 50th anniversary of the Surgeon General giving the report that smoking was associated with lung cancer. So overall, smoking rates in general have crept down in the United States, but still there is a significant incidence of lung cancer in our population.
And even people who haven't smoked.
Right. What we found, especially in women, that there are people that have never smoked a cigarette in their life that will get lung cancer. And we're not sure the cause. Some people think there may be carcinogens in the air and how we metabolize the carcinogens, because our lung is the interface with our environment. But there definitely are lung cancers that are found in non-smokers.
And so, Mark, I guess I was a little surprised not to see testicular cancer on either of those lists.
So testicular cancer is not as common, but we are seeing that there's actually a substantial increase in the number of men who are presenting with it. And it's important that we make sure and keep getting the message out to men that self-examination, especially in young men, ages 15 to 35, is critical to make sure that we're picking up that cancer early.
Really? That young? That
young. And in fact, the good news on testicular cancer is the last 2 decades have afforded us the ability to now cure it more than 95% of the time.
And is it similar to other cancers where obviously the sooner you get to it, the better?
It definitely is. Once a young man feels that there might be an abnormality in either of the testicles, it would be important to present to his doctor so that we can figure out, is it really something that we need to treat, or is it something just benign, which is also very common.
And so are there established screening methods for testicular cancer?
The most established is monthly, usually in the shower, that men would undergo a testicular self-examination, making sure that there's no hard lumps or bumps on either of the testicles.
And so what are some of the other maybe symptoms that someone might experience?
Sometimes in more advanced cases, certainly there can be some testicle pain, clear testicular enlargement. The other thing that men can present with is back pain. But again, it's much, much more important that men pick it up early by way of self-examination.
And so let's come back to the leading cancers among men. Prostate cancer led the list. Have the screening techniques for prostate cancer changed recently?
So the guidelines have changed. We've now had a blood test called the PSA, prostate-specific antigen. So just a simple blood test that we've been using almost 25 years now. And the guidelines have changed in that there's some controversy as to whether people feel it's really worthwhile for men to have it. In essence, the death rate from prostate cancer has actually come down since the use of PSA has started, and the number of men at risk of prostate cancer has gone up. So I think in the next few years we're going to see that PSA is going to be reestablished as an important test for men to consider having. and especially if they're African American descent, especially if they have a family history.
And so at what age would this screening take place?
Typically for men at risk, so again, the positive family history of the cancer, as well as African American, we'd consider screening at age 40, and for other men at age 50.
And so lung cancer is the second most common cancer among men, but it's the #1 cancer killer among men. And as we talked about earlier, the easiest way to avoid that is to stop smoking or not smoke at all.
No, yeah, it's very clearly associated with smoking, and obviously the best thing to do is not smoke, or if you have smoking or still smoking, do a smoking cessation program for sure.
Is there a way to test for lung cancer?
Well, we've struggled with that a little bit, and the best way we've used for years was just having a chest x-ray, but now we have a tool that's been around for a number of years called a CAT scan. And there was recently a national trial that some of my colleagues at Fletcher Allen were the leaders of, that actually did a screening looking at high-risk individuals, so patients between 55 and 74 years of age, both men and women, who have smoked more than what we call 30 pack years, which if you smoke 1 pack a day, if you smoke for 10 years, that's 10 pack years. If you smoke 2 packs a day, it would be 20. So if you had 30 pack years and you're between 55 and 74, you got randomized, or the group got split into 2 to either have a chest x-ray once a year or a CAT scan with low-dose radiation. And what they did was then they followed them for 5 years, and then they picked up the small cancers and treated them, and they discovered that there was more smaller cancers that were detected earlier in the CAT scan group and more survivors. So it's pretty clear that low-dose CT scan is now going to be the standard for a screening tool for detection of early lung cancer.
And that would be people who are at risk?
People who are at risk. So the current is either strong family history or, most importantly, a smoking history and being of the age of 55 to 74.
And how important is it to get these cancers early?
Well, most of the time when a patient presents with a lung cancer, like coughing up blood or pneumonia, oftentimes the cancer is quite advanced, and those patients don't have the same survival as somebody who's picked up with a cancer that has no symptoms, like a tiny marble-sized cancer that doesn't cause any symptoms. Those are the patients that we can achieve a 75% or even higher cure rate. Patients that have extended cancers, generally the survival rate is not as high. So we like to see patients with earlier tumors that we can hopefully have a chance to cure.
And when it comes to lung cancer, can it reoccur?
Well, lung cancer, it does reoccur. I mean, 90% of people present with cancers, and a lot of them do recur over time. And we do have the chance of curing, a smaller percentage. We haven't made great inroads in the treatment of lung cancer over the years. We've made great inroads in discovering cancers earlier and operating when they're smaller with having higher survival rates. But they are still, the whole key is to try to discover the cancers early and be able to surgically remove the tumors.
And so third on the list of the leading cancers among men is colorectal cancer. What prevention and screening techniques are available?
Well, obviously Mark and I aren't colorectal surgeons, but it's pretty clear that screening for colorectal surgery should start at the age of 50, and generally with a colonoscopy. And then if there are no polyps found and you have a clean colonoscopy, I think the recommendation is to wait 10 years, and if you have polyps, they usually repeat it at an earlier interval. But really, colonoscopy is the screening tool for people over 50.
But you have to admit, it's a test that not many people look forward to or really even want to pursue.
Well, that is absolutely true, Judy, but I meant the people that have early stage colon cancers. Colon cancer is a preventable disease without a question. And so nowadays with the anesthesia that they can give you during the procedure, I think the preparation is worse than the procedure. Having had a person
having gone through it myself, I would have to say that's true.
But I think that sometimes you just have to say, my family wants me to stay around, and this is something that I need to do to be screened for colon cancer.
Are there other things that folks can do too to help prevent polyps and colon cancer?
Yeah.
Go ahead.
Well, definitely. In fact, the most important is diet. Heart healthy is colon healthy, is prostate healthy. So in essence, low fat, high fiber, fruits and vegetables, very, very important for colon cancer. And if I may, I just want to touch on one Parallel with lung cancer, many people don't know that bladder cancer, another important cause of cancer death in men more commonly than women, is linked to smoking as well. So another case where if a man sees blood in their urine, I can understand firsthand why men wouldn't want to come see the doctor. But it is very important, again, to present to your doc if there's a problem so that we get on earlier treatment, because that's more likely to be curative, just like Bruce has said.
And so based on your experience, what overall message would you want to share with men about their health and their cancer risks?
So I think the thing that we have to think about now is we've gotten much better at cardiac care, so that now cancer deaths are starting to almost surpass cardiac deaths in the population in general. So we have to become as attentive to the subtle signs of things that we need to do to present early to the doctor. So blood in the urine, any pain anywhere that we can't explain, lumps on the testicles. But in general, in terms of preventing these cancers, the most important thing is, again, a healthy lifestyle. So remaining active, regular exercise, and we are what we eat. So a good diet is paramount to a plan for healthy living.
And so once you convince your husband or your brother decides to go see the doctor, what are some of the things that they should ask in their exam, in a routine physical exam perhaps?
You mean the patient asks the doctor?
Right.
Well, I think that, you know, patients need, as we spoke about earlier, to be proactive, that they need to say to their doctor, hey, you know, what about my prostate? I'm 50 years old, shouldn't I have a PSA exam? Is it time for my colonoscopy? I mean, you know, in other words, to be proactive in your health. You know, you can say, you know, doc, I don't smoke, I exercise, I do the right things, but I still know that some cancers can come even though those don't happen, so how can I be screened? What can I do to maximize my chance of hopefully, if I have one of these cancers, discovering it at an early stage? Making sure your doctor knows your family history. It's really important to know if there's a family history of prostate cancer or lung cancer, because there may be a predilection for you to develop it at maybe a little higher frequency than the general population. So giving your doctor as much information as you can, your family doctor or your regular doctor.
And even things like maybe something that they wouldn't associate with any kind of a disease they should tell their doctor about as far as
Absolutely. You know, communication is key with your doc. And in essence, oftentimes patients are a little bit worried about how the doctor would treat them. I wouldn't hesitate to have any patient look at their physician and say, well, what would you do? That tends to be it's a hard question for doctors, but it's the right question for patients.
And so our goal this afternoon was to raise men's cancer awareness, and it's a topic that has gained some national attention. And I know back in November, there was something called the Movember mustache campaign. Can you tell me about that?
Well, I have a 26-year-old son who works in Denver in a software company, and last year his company was very aware of this Movember movement, which started about 10 or 11 years ago in Australia, focusing on issues of men's health, and men would grow a mustache during the month of November to raise awareness for men's health. And a lot of sports figures. I went to a Patriots game in October, and the players were starting to start their mustaches for Movember. So my son said, hey, Dad, what's going on up there in Vermont? And I said, we're behind the times here on that. We haven't really focused on Movember. So I brought it up to my colleague and friend Mark and people at the Vermont Cancer Center, and we said, hey, let's, so a lot of us grew mustaches for the month of Movember, and we're hoping for a more vigorous year next November to spread a little more awareness at our hospital.
And tell me a little bit again about how important it is for men to sort of take the first step and make that call, make the doctor's appointment, and really take control of their health.
Well, I think that's the real important message here today, Judy, that, you know, we focus a lot on women's health, very important, but men have really said, oh, I'm healthy, I don't need to see the doctor, you know, I'm healthy as a horse. And they really need to be aware of their health and to be screened for potential curative cancers that are out there. And so really, you know, go to your doctor, talk with your doctor, and really focus on doing the right things for you.
Anything that you want to add?
Absolutely. I agree with Bruce wholeheartedly. What we as men need to do is we need to follow the lead that women have provided us.
Absolutely.
They're proactive about their health. They're proactive about important cancers, and we as men need to do the same. So thank you for giving us the opportunity.
Well, thank you so much for joining us today.
Thank you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.